World Oral Health Day 2023 happened on Monday, but it doesn't stop us continuing the conversation around oral health. And the theme for this year is be proud of your mouth. Now, what is World Oral Health Day's purpose? World Oral Health Day aims to empower people with the knowledge, tools, and confidence to secure good oral health. Why is World Oral Health Day important? Well, oral diseases are a major health concern for many countries and negatively impact people throughout their lives. Oral diseases lead to pain and discomfort, social isolation, and loss of self-confidence, and they are often linked to other serious health issues. And yet, there's no reason to suffer. Most oral health conditions are largely preventable and can be treated in their early stages. Now, this oral health interview is proudly brought to you by SADA. SADA's vision is to be recognized as the trusted leader and voice of oral health care in Southern Africa. Their mission is to promote the interests and serve the needs of their members and, above all, encourage optimal oral health care for all South Africans. Learn more about the South African Dental Association by visiting www.sada.co.za. Also, be sure to check out more about the Young Dentists Council. Learn more about the Young Dentists Council by visiting www.sada.co.za/young-dentists-council-YDC. All right. So, today going to be talking to Dr. Rohini Bisaal. So just to give you a bit of a background about Dr. Bisaal, is a qualified dentist graduating from the University of the Western Cape in 2017. She was also part of the Golden Key Society during her academic career. She is currently in her 5th year of private practice situated in Belito, KZN, with a great passion and keen interest in dentistry as a whole. She's a general dentist offering treatments ranging from general dentistry to clear braces, smile makeovers, and teeth whitening, to name a few. Community is a huge part of her life, which she builds using her social media presence, therefore engaging with and provide necessary dental information on her dental page, and works with brands in general on her personal page. She balances a professional life as a dentist and a part-time model influencer. Wow. To not only break the barriers of having multiple careers, but still thrive in both. She believes strongly in encouraging the youth of today, especially females, to always aspire towards their dreams, regardless of what society may deem correct. Aside from her personal pursuits, she's keen on working with the Young Dental Council to reach out to the young dentists and share knowledge and help with overall guidance and development. On a personal level, she has a history in pageantry. Miss India SA, First Princess 2016, Miss Uni World Brand Ambassador for 2018, International Modeling and Dancing, shot for the cover of the Get It magazine in the North Coast 2020, and was on many TV and radio interviews. When she is not actively working on her careers, she loves spending quality time with family, reading, listening to podcasts, and going on adventures. Wow, that is an impressive biography. Dr. Rohini Bisaal, how are you, man?
Well, thanks. And how are you, Stephen?
I'm good, thank you. Did I miss anything? Eh?
Oh, no, you did great. Thank you.
Wow, that's an impressive biography. I love that.
Thank you. Thank you so much. Thanks for having me as well.
No, it's a pleasure. I look forward to talking to you. So, all right. So we're talking about World Oral Health Day, which was on the 20th of March, but also the importance of kind of World Oral Health Month and looking after your mouth. The theme for this year is be proud of your mouth. So, Dr. Bisaal, why is World Oral Health Day significant, and why should we be creating an awareness around it?
Well, Stephen, let's be real, right? Who really likes going to the dentist? I mean, it's a very few people that really do, and I truly believe that creating an awareness in a more and a friendly approach, I feel, it will decrease the overall anxiety and a negative association with regards to going to the dentist. I also feel it will encourage the public as a whole to take the leap and go in for their regular checkups. Now, these regular will not only detect the minor issues, but will also prevent these minor issues from exacerbating into major issues if it is left untreated. For example, right, if a patient comes in with a small cavity, it can be filled with a basic restoration. But if that cavity is left untreated and it progresses, the potential to enter the nerve system and then needing a root canal, the chances of that obviously increase. So going to the dentist every 6 months is very important just to pick up on these minor issues to prevent further problems in the future. So yeah.
Absolutely. So please share 5 key important factors pertaining to a healthy oral environment. Could be dental tips to maintain good oral health. What should we be doing?
Okay, so number one, it's very simple. Visiting your dentist every 6 months. You can put a reminder on your phone. It's easy peasy, lemon squeezy. And this is also to remove any of that buildup and the plaque around those hard to reach areas. So it will prevent any sort of gum disease and infections overall. That's number one. Number two, always rinse with water after every meal. It will not only just give you a good fresh breath as well, but it will also neutralize the oral environment to prevent any unwanted sugar attack on the teeth. Flossing and using interdental aids to remove plaque and buildup from those areas. Basically, those areas that you're not able to reach with a toothbrush are very, very important. Number four, a healthy diet, which will ensure that your teeth are also being nourished and kept strong, as well as eating foods rich in calcium and ones that are not very high in sugars. And lastly, brushing your tongue, which is something that we tend to miss.
Yeah.
The tongue is a large surface area in our mouth, right? So that also allows for attachment of unwanted germs and plaque, and that can stretch the rest of the oral cavity. So we have to also consider brushing our tongue really, really well.
So what can we do to prevent oral health issues or diseases in general?
Okay, so basically, if you do feel as if you detect any sort of issues in the mouth, go and see your dentist ASAP, right? Don't wait until you have a toothache, and also taking care of your body and health as a whole to prevent those unwanted conditions and diseases. Your oral healthcare practices are also very, very important. So to ensure that you brush twice a day, plus once a day, and your lifestyle choices. For example, smoking, high intake of alcohol, any sugary foods, unfavorable habits such as eating your ice cubes, and I know we all are guilty of this, and we've done this in our life, biting off any tags of old clothing. So it's just those few little things.
Okay, and how can we encourage kids to maintain a healthy oral environment? Because always when we say to our children, hey, we're going to take you to the dentist, they're like, ooh, okay, wow.
Yeah. So like starting off with the little ones from a very young age is super important. I think it sets the precedent of a very healthy oral environment in the future. So the best thing for parents to do is to demonstrate and guide them until they're the age of 6. So when they're at the age of 6, they will have their dexterity to then brush on their own, but obviously not leaving them alone to brush on their own. Also just monitor that they're doing it correctly and so on. I also love putting on some really cute little cartoons or child-friendly videos. I mean, there's an example that's really awesome that I use in the practice a lot. It's a Peppa Pig goes to the dentist. It works like a gym, and it is absolutely cute. So it's something that will captivate the kids as well.
Yes.
Also just play their favorite song. I always tell the patients, getting your kid to brush for 2 minutes, it is a struggle. So try to make it fun. Try to play their favorite song or do some sort of activity while they are brushing their teeth, and obviously monitor that so it becomes some sort of a fun activity for them. And lastly, teach them about the cavities. Educate them on why cavities are not good and how they can destroy their teeth. I mean, they're lucky that they're going to have a second chance and get their permanent teeth thereafter.
Yeah.
But it will also just educate them and make them understand the importance of teeth and the functioning and so on. So yeah, I think those are the really important factors for little ones.
All right, so if you have just joined us, Clicks Live, Revitalizing Radio, Stephen Taylor with you on this Thursday afternoon, chatting to Dr. Rohini Bisaal. Dr. Bisaal, what is halitosis and how does it occur, and what factors contribute to it?
Okay, so halitosis is essentially bad breath, right? All of us have experienced this at some point in our lives where we are not happy with how our breath smells and so on and so forth. And we ask ourselves, why does this happen?
Yeah.
Right? So there's a lot of factors with regards to that. Number one, obviously, your oral health care practices, it could be better, right? So if you skip your brushing and your flossing and so on, remember the accumulation of plaque, it basically creates a nice little colony of bacteria, right? Smoking as well is one of the huge contributing factors, as well as drinking excess coffee and alcohol. So all of those, anything that we ingest in our body, remember our mouth is the portal to anything that goes into our body. And if, obviously, it is not favorable, it tends to bring about an unfavorable, undesirable smell, right? Another one that's very, very important, underlying medical conditions.
Yeah.
I'm going to just speak briefly about one specific condition that I see with a lot of my patients, because a lot of my patients are diabetic. So if you do suffer from diabetes, or you have family members, or you have a history of diabetes in the family, that can also affect the breath purely because it decreases the salivary flow within the mouth, so you tend to get a dry mouth, right? And that also contributes to unfavorable, undesirable smell in the mouth. And with some parts of diabetes, there's something called a ketotic breath, where the breath can start to smell very sweet. So that's, these underlying medical conditions, it also can exacerbate into unfavorable oral problems overall.
Okay, and please share with us the importance of a toothbrush as well as interdental aids and how to optimally use them both. What is an interdental aid?
Okay, so pretty much interdental aids are like those little aids that go in between your teeth. So like your flossing, your little soft gum picks, those hard to reach areas, right? So we call them interdental aids purely because it goes in between the tooth surfaces that pretty much we do not, or we don't have access to with a normal toothbrush.
Yes.
So remember now, we also have, we've advanced quite a bit in dentistry where we now have the option of using a manual toothbrush or an electric toothbrush. With regards to both of them, yes, an electric toothbrush is brilliant because it gives you that vibratory action and it really gets into the crevices of the gums and so on. But that does not mean that your manual toothbrush is any less effective, I would say.
Yes.
But there's a certain technique. It's called a modified dash technique. Now, that technique is where we angle our toothbrush, or the head of our toothbrush, at a 45-degree angle to the gum line. That's where most of the plaque gets accumulated underneath the gums. And that technique is essentially going to brush out any bacteria and plaque from those hard-to-reach areas and clean the teeth optimally. So with regards to brushing, that is your desired way of brushing, and that's going to definitely help lessen the plaque buildup. With regards to your incidental aids, as I've mentioned, your flossing, your soft picks, even MaxiFloss. So patients that have braces or they have the retainer after orthodontics, MaxiFloss is your go-to. So you literally weave in this floss in between your teeth, and that will clean in those areas optimally. Now, if you don't do that, especially if you have braces, that can lead to cavities that develop in between your teeth. So that is why it is so important to clean those areas.
Clicks Live, Revitalizing Radio. Stephen Taylor with you, chatting to Dr. Rohini Bisaal, of course, all around World Oral Health Day, World Oral Health Month. The theme for this year, be proud of your mouth. Dr. Bisaal, what are some of the underlying diseases that may contribute to a compromised oral health?
Okay, so as I mentioned before, diabetes is one of the biggest ones. That obviously it will cause your halitosis, your bad breath, your impaired hearing and dry mouth. Also osteoporosis. So patients that suffer from osteoporosis or any sort of bone disease in general, that will affect the bone levels in the mouth. Now remember, our tooth is held by our bone. Now if a patient presents and they have basically if they have a disease that targets the bone, that will then decrease, or basically it would decrease that strength of your bone, which will eventually also decrease the strength of the bone in the jaw. So that can also cause, mobile teeth or the teeth getting loose over time and bone loss and so on. So that, I see that also very, very often. So patients that are diagnosed, taking certain precautions to prevent further bone loss will definitely be a very good step going forward with their oral health. Some sort of cancers as well. Now remember when we have cancer, our immunity overall is decreased. So our white blood cells are not as effective as they normally are, and fighting off any diseases and infections in the lung can be a bit of a problem. So definitely that one, and any sort of immunocompromised diseases where the immune system wants to attack itself. So that is also a huge contributing factor. So any patient that comes in, or if any patient has or is diagnosed with any sort of medical condition, I highly advise that they also look at the adverse effects within the dental realm, so they can also take that initiative to, maintain the oral environment, and that will also help with their journey overall.
Dr. Bisaal, how can dental professionals encourage good oral health and create a positive change within the dental realm, like going to schools, outreach programs, community building programs, in-chair education, and interviews like this,
Of course. Look, that's the beauty of the day that we live in now and the time that we live in now.
Yeah.
I think that there's so much of reach. We can reach so many people through the work that we do, but also, for example, an interview like this, interacting with different people, also being approachable, I think as dental professionals, it's been a bit of a struggle where we've been painted with, fear and anxiety, and people don't essentially want to go to the dentist. So I think as dental professionals, it's up to us, and the onus is on us to change up the game. Make it a bit more approachable, make it a bit more fun, educate the public, go to schools, community building projects. I think that's so important. And I do, if any of the dentists are hearing this now, I do encourage them as well, to come together, do some community projects, also just help out in whatever way that you can, so we can also just help the community at a large to not be so fearful or have so much of anxiety around the dental realm. So I think all of those small little things that we can take into consideration will help in the long run, for sure.
I love that. Any closing thoughts, and how can listeners get in touch with you?
Sure. So I am based at the Belize Junction Mall with Family Dental Care. And if anybody would like to make a booking, you can call us on 032-586-1819, or you can reach me on my email, which is Rohini, Rohini, at my surname, Bisaal, BISAAL.co.za. Or you can check me out on Instagram as well. I'll be on there as well.
Wow. That's amazing. So thank you very much for your time, Doctor. I appreciate that. And people want to get hold of you or make a booking to come and see you, 032-586-1819, or simply Rohini at bisaal.co.za, Bisaal.co.za. There we go.